Do you know that you don't need shit to happen to you before you see a preventive medicine specialist? Wait, what's a preventive medicine specialist? This is What's Up, Doc? Hi, welcome to What's Up, Doc? Brought to you by Mission at Night. This is where we peel back the curtains of medical mystery and deep dive with doctors from every corner of the healthcare universe. And we're not just talking about health, we are living it, learning it. This is where we'll get insider insights from the doctors that you can apply directly to your life. It's not just talk, but it's a gateway to a healthier life. So let's decode the secrets of health together today with Dr. Hisham. So Dr. Hisham is a preventive medicine specialist. Welcome, doctor.
Hi, Tilly. Thanks for inviting me over.
So I heard that you actually was previously in the emergency and then now you became a preventive medicine specialist.
Yeah, that's right. So I graduated many years ago, actually in 1995. And, after doing my housemanship in the UK, I went into emergency medicine. Right. And in emergency medicine, what happened was that I saw a lot of young people with heart attacks, strokes, things that shouldn't be happening to them at their age.
When you say young, how young are they?
30, 40s, right? So for me, it didn't seem right. Right, it's because when you read in the textbooks, right, these conditions are usually affecting elderly.
Yeah, the 60s.
Yeah, 50s, 60s, right?
50s also touching a little bit.
Yeah. So I thought perhaps this was because I was working in London or Edinburgh, different geographies, different situations. But when I came back to Southeast Asia, I wasn't working in Singapore. I was working in another country. I saw the same thing. I got me thinking, what's happening here, right? So I asked my boss at that point in time, hey, I want to research and look into why people are having all this, chronic diseases, heart attacks at a young age. And then he told me, I'm not paying you to study this. I'm paying you to treat. A lot of soul searching. I decided, hey, I know that I've only got a couple of years left before I become a consultant and specialist, but this isn't right. I didn't feel right. I went back to nearly square one and redid my whole training and went into preventive medicine. So I've been doing this for about 22 years now.
22 years? Wow. So what does preventive medicine do actually?
So it's a bit of a strange thing. If you go and see a doctor, you expect to be treated, right?
Yes.
You don't expect a doctor to try and prevent you from getting disease. But there's this whole movement now, right? And I'm glad I've done it, for 2 decades now. Whole movement because a lot of diseases can be prevented, right? A lot of diseases can be controlled. Right, and the science is growing, the knowledge is growing in the fact that with not just with supplements but with lifestyle and everything else. So what we do is we try and see the status of a patient's health, right, and then try and modify it so that they don't get things like hypertension, cholesterol, diabetes, which then leads to other things.
The usual 3 highs that we talk about in Singapore, is that right?
Yeah, that's right. Which is also increasing in terms of incidence and prevalence in Singapore. Yeah, and as we said just now, in younger people.
Yeah. So these 3 highs are happening still in Singapore itself.
Yes.
Are they more apparent in the Asian countries or?
No, I think it's a worldwide global phenomenon now. So younger people are getting, sick with high cholesterol, right? I believe it's, 1 in 3 or 1 in 4 in Singapore, right? People having pre-diabetes, diabetes, right? People with hypertension as well, right? So it's not just Singapore. Although in terms of statistics, Singapore is very good, so we keep track of things, right? And we have the information, but it's also happening worldwide. And a lot of it's to do with our modern lifestyle, right? The food that we eat, the stress that we face, right? The lack of sleep, right?
The lack of sleep as well.
Yeah, lack of sleep.
Okay.
Sleep affects our health in many ways that people don't actually know about, but we can go into that later on. Yeah.
So you mentioned that the 20s, right? 27, 28s. What about the 22, 23s? Are they similar or?
So we do get people in the younger 20s with high cholesterol or even diabetes or hypertension, but it's not as much as 30s or 40s, or it goes up with age. But if you compare from the incidence or the statistics from the 1990s all the way to now, you see that in terms of age groups, okay, every age group there's an increase.
So you mentioned that every age group there is an increase. My question to you is, are you seeing this more apparent gradually to the younger ones? Because I mean, we used to hear that it's used to be 50s, 60s. Now I'm hearing it from the early 20s, right?
Yeah. Early 20s, not so much, but mainly 30s, you start becoming apparent, all right? Yes, I do see my patients with high cholesterol, okay?
So the trend is increasing, moving to the younger ones.
Yes, that's right. Yeah.
Right.
Yeah.
So what are these causes to these three highs actually?
Okay, so there's two major components to the risk factors, right?
Okay.
One, risk factors that you can modify. One that you cannot modify. What can you not modify, right? Your genetics, right? Okay, you cannot modify, right? You know, your male or female. Well, although some people, okay, let's not go into that, right? That's a different story altogether. Yeah, your DNA, right? You know, age to a certain extent. Some people say, you know, your chronological age, the age for you know, from where you are born, year to year, you cannot change. But some experts or some scientists say your biological age you can modify, but we can discuss that later on. Yeah. Okay. So those are the things that cannot be really modified. Okay. But in terms of genetics, okay, that only plays 20 to 30% of the outcome. Right. All right. So 70 to 80% is actually lifestyle, your environment surrounding you and things like that. All right. Okay. Now, if you think about it, right, you know, Singapore has been designated the 6th blue zone. Blue zones are geographies and areas around the world where people live till, you know, long life, right?
Really?
Yeah.
Singapore. Despite our stressful nature, you know?
Yeah. So I'm equally surprised, right, when it was announced, right? So they say that it's because, you know, in terms of lifespan, we have increased dramatically over the past few years. That in itself is because of our kind of socio-economic factors, right? Your economy, your you know, ability to afford
better food, better rest, go for massage once in a while.
So that plays a factor into it. But if you, so we live to an average about 84 years old in Singapore, which is good, right? Okay, women slightly more than men, but that's a trend all over the world. Okay, but we spend about 10 years of that 84 years in healthcare. Okay, which is a long time. So my mission is actually trying to reduce that 10 years to just a few years. So because it's very costly.
Yes, it is.
It's very costly, right? You know, you would know this, right? You know, with claims and things like that. So Singapore has been designated the 6th blue zone, right? So I'm equally surprised.
Yes.
Okay, equally surprised. But the fact is that in the blue zones, you can see the blue zones being, you know, the Mediterranean, some other parts of the world, you know, southern Japan. You can see that the environment, the food that they eat, the social connections they have, it plays a major factor. Right?
So our char kway teows are okay?
Well, I can't say that. I can't say that. Okay, I can't say you know, that char kway teow is okay. But you know, in moderations perhaps, and things like that. Definitely in Singapore, diet plays a big part. You can see that the obesity rates are going up.
Yeah.
Diabetes also going up.
Yeah.
Hypertension is going up. So a lot of it, and cholesterol as well, right? You know, so a lot of it's related to diet. Okay. We don't have time in Singapore to exercise.
Yes.
Right? We don't have time to sleep.
Yes.
Right? Okay. We're stressed out.
Yeah, that's right.
right? We're stressed out, okay?
Yeah.
So these factors eventually, gradually, year over year over year, okay, will play a part in the deterioration of your health, right? So, and to me, I think it makes sense to try and prevent it from happening.
Okay.
So, and that's what I do, right?
All right. So you prevent people's health from deteriorating and all. So which stage do they actually come and look for you?
So unfortunately, a number of them come a bit too late.
Okay.
They already have high cholesterol or signs of pre-diabetes or elevated blood pressure. So I don't take anyone below the age of 21.
Okay.
Or 20. Okay, because the thing is that you're still growing and things like that. You're still developing, and some of the things that we provide may not be suitable for those. In terms of supplements and things like that. Those below the age of 20. Okay, now. So most of my patients are actually fall between the age of 30 to 40. So I've got 4 categories of patients. Okay. Right. So 20s to 30s. Okay. Interested in in their health. Okay. But mainly to look good and feel good.
But they're all healthy and all, right?
Well, mostly, mostly healthy. They want to feel good and they want to look good, right? Yeah. They want to enjoy life.
Okay.
And nothing wrong with that, right? Yeah. I used to be 20. I'm 52, going 53 now.
You don't look like that.
Oh, thank you. It's a lot of creams, but but the thing is, they want to enjoy life and all good for them, right?
Yes.
30 to 40, getting a bit concerned, right? So I have got this group of 30 to 40s getting a bit concerned. They're a bit more knowledgeable about their health. They have a bit more, I would say, spending power.
Okay.
For health. So they go for screenings and things like that. And we can talk about whether I believe in screenings or not later on. Okay. All right. Okay. So that's 30 to 40s, okay? But still, they in terms of knowledge and understanding, not so much. 40 to 50 is when you get very tired.
Right.
You're starting to feel to have a family, right? They starting to have a family. They're starting to be the age where their uncle passed away at 55. All this is starting to get worried. So they do that. Unfortunately, around there it's a bit too late.
Really?
Yeah. So you should start looking after your health when 20, 30s, right? Not when you're 40, when you're feeling tired.
40s right? Shouldn't be that bad, right?
Well, actually, if you maybe it's the demographic of my patients, but you get things a bit wrong.
You are a doctor, you know best.
Okay, so. And then 50s to 60s, that's when they want control over their health, okay? Because they're going to the stage where they need to function and things like that. Retirement age in Singapore is going up and up and up, and therefore you still need to be able to function cognitively, mobility-wise, right? In order to do your job, right? So those are my patients. So we do get majority are above 30 years old, but we do get this small percentage in the 20s to 30s. Yeah.
That's very interesting. So when they look for you, okay, let's go by age band first, the early, let's talk about the 50s, 60s first.
Yeah.
Rather the whole 40 to 60 range, right?
Yeah.
Right. When they look for you, right, most of them would have really been quite bad.
To a certain extent, right?
Yeah. So what do you do for them?
So what I do is actually I sit them down, okay, and the consult is not your typical GP consult of 5 minutes to 10 minutes. Okay, it takes about 45 minutes to an hour.
Okay.
All right, and I go through basically what has happened in their life.
All right.
What is their life currently now? Okay, their social condition, the social connections, whether they're married, children, also what do they do, right? Travel a lot, sleep, exercise, nutrition, right? I look at what medications they're on, what supplementation they're on, all right? What treatments they've had, surgeries they had, and everything. I paint the picture of who you are from the time, before, okay, and how you got here. And because that tells me a lot about the risk factors from before.
Yes.
Right? Okay. Then what I do is then I do an assessment of them.
Okay.
Some, some testing, like looking at their percentage body fat, your muscle mass, and everything else. Of course, the body mass index. Okay, which I don't quite follow, right? Okay, because you can be muscular, but your body mass index.
Yes,
Yeah,
correct.
right. Okay, but do a bit of assessments and things like that. What I do is I look at their biomarkers. Biomarkers. So it's a lot more comprehensive than your usual health screening. Okay, it's different from health screening though.
Yeah.
Okay, I don't call it health screening because health screening is trying to detect early disease. Right?
Okay.
I'm trying to not detect.
Ban it, and I saw it maybe some signs going to early disease.
Yeah, so
right. If you continue your lifestyle, you might hit it.
Yeah. So the reference ranges are also different because the thing is, if you look at conventional reference ranges, right, you might be normal, right?
Yes.
But if you want to prevent it, you want it to be lower, right?
Yeah, that's right.
Yeah. So things like your LDL, cholesterol, right? Your ApoB, which not many doctors will do. Okay, it's another type of
Diagnosis.
lipid.
Okay. Yeah.
Lipid. I look at homocysteine, cortisol. I look at testosterone levels. A lot more. So it's about 76 plus biomarkers. Okay, but I don't want to get too hung up about how many numbers and things like that. And it can go up to 100 plus different things. What I then do is then look at that and then analyze it. Okay, using a platform. Okay, and then what we do is we look at your risk factors.
Right.
For the development of chronic diseases and things like that. And then what we do is then see, right, what's the program for you to then, prevent chronic disease from happening?
Right.
Yeah. So that's it. And get additional tests if required and things like that. So in a way, this is longevity medicine, right? And if you go to, the longevity centers in Europe and US, you'll be spending about 40K.
Wait. A treatment, a year?
No, that's just the diagnosis.
Just the diagnosis?
Yeah.
40K?
Yeah, it's about 30K to 40K, right?
Okay.
Yeah, USD. Okay. And so that's why the longevity medicines for the rich and famous.
Yes.
Okay.
Yes.
All right. The well-heeled. Now, in Singapore, I know of certain clinics that charge maybe, still 5 figures, but less than 20K. All right. And some are, about 5,000 to 10,000. Right. So I don't believe in that. I don't believe that this science, this whole thing should just be for the rich people.
Yeah.
Okay. Sorry to those who are rich. Okay. It's good for you that you're
Give us a chance, please.
So it should be for the masses. So my aim is to try and democratize it. So that's why I start with biomarkers first and then I work it up. So part of it is also looking at your genetics.
Yeah.
Okay. Yeah, you can do it if you're interested. All right. Looking at basically your biological clocks. Right. Okay. Look at things like DNA methylation, telomere length, all these. Very chim, okay?
Yeah, very chim. I wanted to ask
you
more
about
about it.
microbiome and things like that.
Yeah.
And then look at things like, some people go for exercise ECG stress tests.
Yeah.
We don't. We go straight and do your, coronary angiogram with, calcium score. We look at basically how thick your carotid artery is. Yeah, we look at how fast a wave goes from your carotid artery to your femoral artery and things like that. So these things we do are very different and differentiates us from health screening. And a lot of patients don't, they come to us and say, hey, how come this health screening very expensive? Actually, it's not really health screening. Yeah, but yeah. So I just wanted to lay it out there.
So when you say, expensive and all, right, exactly roughly how much the package ranges from?
So ours is roughly for the biomarkers about less than $600.
Okay.
Okay. But, it's still expensive, I must say. You're right. But if you compare it to $15,000, right? $5,000.
Yes.
So what I do is then I plan the steps needed for the next 3 months, 6 months, and 1 year on what steps we need to do and focus on things like that. So we don't do the whole thing. We do things which are necessary for you.
Okay.
So if we say that your cholesterol is really high, right? You're pre-diabetic. We focus on that. We try and bring it down.
Right.
Okay. Try and bring it down. medications are necessary. Okay, medications are necessary. Supplementation may be necessary. Okay, but the aim is to try and stabilize your lifestyle to the fact that we can then try and see if we can reduce the dosage, reduce the frequency, or reduce the need for it.
So these are medications like your cholesterol medicines?
Yeah, statins or things like that. I use a lot more advanced things like ezetimibe, PSC9-CKI, those kind of things. Yeah, to bring it down, not quickly but effectively.
So, just a quick summarize of what you just taught me through, right? For our users, our viewers to actually understand. So I go for a test, right? Maybe a 600 plus. And then in that 600 plus test, with a consultation with you, right, we'll work out a year plan. And of course, in the year plan, it will consist of a breakdown from 3 months, 6 months, and so on and so forth.
Yeah.
And of course, in that plan itself, should there be a need to, depending on your age and the different markers, right, then we'll go for more extensive tests. Is that right?
That's right.
And we review that on a yearly basis? Or?
So we have a plan where the plan consists of a review at 3 months, 6 months, and then 12 months, right? So, and then if we will discuss, right? It's not, my style is not the kind of style of a doctor saying, I'm the doctor, you listen to me, right? You know, it's a two-way conversation. All right, because it's your body, it's your life, you know, right? So you should take control of it, right? And I'm there as a guide, right? I'm there as a guide. So what we do is, if it's necessary, then we will discuss it. Okay, if it's necessary for things like personal trainers, physios, or maybe nutritionists, you can do that. I utilize a lot of technology, AI and things like that helps to reduce the cost down. So, you know, so we try and utilize that.
Right, I know. Anyway, in case you guys do not know, right, Dr. Hisham has a TikTok account. Right, where he will actually show the TikTok account. You actually, give you little tips over there, right? I'll put the TikTok account into the comments box, and please do go and follow him. Right,
so it's actually very embarrassing, the TikTok account, right? Okay, but it's actually started off because my sons say you have to have TikTok, right? I've got 3 sons. One's 21 doing NS, one's 16, and one's 10, right? So a big age group. But they say, look, no one will follow you on LinkedIn. I said, well, I've got a few thousand followers on LinkedIn. But that's a different demographic. And I realized that actually the 20-odd to 30-odd-year-olds, they get their information from TikTok. So they come to the clinic with all this information, perhaps misinformation. Then they come and talk to me. And for me, it's like, how do I counteract this, right? All these things. I don't have that many followers. It's just new, but it's fun. It's a Sunday night, evening with my sons. I make the TikToks. They need pocket money, so I ask them to edit it. So it's
a
good
win-win.
fun. Yeah, it's a win-win, right?
Family bonding,
yeah. They get bonus for doing for finishing the editing in 1 week. So
wow, that's not too bad. I wish I should hire them too.
Give commission to me.
Yeah, why not? So that's it. Back to that. No, when we talk about we talk about that in the 40s and 60s. I think those are very clear to most of our viewers out there how it should be done. Now I'm curious. The 20s and the 30s, right? Same procedures.
No. So 20 and 30s, I will get to understand you. Okay. And then I'll say, okay, for you, what's your focus? It's always what's your focus? What's your focus? They say, oh, I want to be able to run a marathon. Okay, sure. Let's go for it. Right? Let's aim towards that. Okay, so we focus on fitness. Okay, I want to lose weight. We focus on that. Okay, yeah. So it depends on different focus. Even for the 40s to 60s, I will tell them, okay, what's your focus? Right? The focus is actually, I've got a family history of cancer. So and as part of the biomarkers and things, I do look at certain types of cancers, and we're trying to evaluate better, more comprehensive cancer testing as well.
Right.
So it's always about the focus, which is a bit different from the health screening packages that you see in many clinics. They say, what is it called? Basic, executive, premium, or something like that. And to be honest with you, right? You do an ECG, 90% will be normal.
Yes.
Right?
Yeah.
Okay. You do all these other things, chest x-ray, a lot of it will be normal, right? You focus on your concerns. You focus on what is required based on your lifestyle, based on your risk factors, right? So that's why the information from on your life, the life that you led till now, all right, the social, circle that you have, right? Okay, and things like that. So I understand that if you are, president of APAC, right, for a multinational company, you'll have to have calls with Europe and US many times a week.
Your timing will be haywire.
Yeah, so you won't get any sleep,
Yeah.
right? You'll be traveling a lot, so your diet will be hectic, right?
Yeah, that's
Things
right.
like that, right? And you won't have time to see the doctor, right?
Yes.
So for me, I've made the practice in such a way that, if you don't have time to come to my clinic, I'll come to you. So I've got the license for that.
Oh,
I can
wow.
do teleconsults
wow.
and things like that. So make it convenient for the patient, right?
That's right.
Yeah.
So when we talk about that, talk about overseas, you talk about not enough sleep and things like that, right? How apparent in our current context with the younger ones?
It's there. They also have problems with sleep, stress, and things like that. In Singapore, people don't tend to talk about it.
Yes.
Right? But they come to the doctor with very, very vague symptoms. They say, "Oh, I've got a headache. I just don't feel well, feel a bit tired," and then you dig deeper.
Yeah.
And then you ask them, so what do you do, right? I've got this, I've got deadlines and things like that. Usually management consultants, but
oh really?
or accountants. Everybody has that, right?
Yeah.
I mean, especially in sales and things, even admin, they've got deadlines and things like that. So sleep is a major issue amongst the 20 to 30 odd year olds. Sleep actually is a risk factor for hypertension, right? Okay. People have said that, have found that if you don't have enough sleep, that's a risk factor for diabetes as well, for elevated sugar. Okay. Yeah. So
it leads on to diabetes.
It leads on to all these things.
Okay.
So hypertension, cholesterol, diabetes, they're all risk factors. And together with obesity, right? And stress, they're all risk factors for more worse chronic diseases such as heart problems, kidney problems, stroke, right? Failure of organs and things like that. So,
I'm asking because when I was about to invite you and they know that you're preventive medicine, many of them ask about sleep, right? And those are the younger groups.
Yeah.
So we understand that in our current lifestyle, there's lots of stress, right? And now I've learned that with that stress, lack of sleep, it leads to diabetes as well. Yeah, but you as a preventive medicine specialist and what do you do with them? How do you actually advise them? Because they are just early 20s.
So I tell them how I do it, right? So sleep, I'm probably the worst patient for sleep.
Okay.
Right? Okay. Because as a doctor, you learn to live without sleep, but it affects you.
Yes,
it affects you. So when I was doing acute medicine, hospital medicine, I averaged about 4 to 5 hours sleep a day.
Wow.
Right. Okay.
How do you survive?
Coffee.
You look so young.
A lot of coffee, a lot of adrenaline, because emergency medicine is adrenaline, right?
Yeah.
But it doesn't help you, right? It doesn't help you. So the thing is, it needs to be a routine, right? Okay, but it's a bit difficult if you do shift work. Okay, night shift. If you travel a lot, the time zones and things like that. But let's put that aside. If you don't, then it's about consistency. It's about routine, right? Main culprit is that blue light from your phone.
Really?
Yeah. Well, one of the culprits, right? So you put that away as far as possible. Okay. The temperature, people say it needs to be about 23 degrees Celsius. Some studies have said that, it's about 23 degrees Celsius.
Yeah.
Okay. That will suck up your electricity. Okay. I put mine about 24, 25. All right. Okay. Yeah. My wife likes 23, but never mind. Okay.
You see, 25 is good for health.
Yeah. It's fine. Okay. Put away that remote control Netflix and things like that. Okay. That's another risk factors. Don't look at your phone for 1 hour before. No coffee
so
after
1 hour
5.
before.
Yeah. around 1 hour before or 2 hours or whatever, right?
Okay.
Yeah, because that will play on your mind, right? Emails, text messages, all these things, right? I use WhatsApp for business because it allows a reply.
The auto reply.
Right? Saying sorry, I'm away or whatever, right?
Yep.
All these things, right? So, but it gets annoying for people, especially to my wife, because she receives that as
the auto message.
she goes, "What is this?" Right? But the thing is, it needs to be a routine. So sometimes people use sand, sometimes people use, noise cancelling, all these things. What I do with some patients who have difficulty sleeping is if they have a wearable, is I look at that data, the sleep data, the quality of the sleep, the duration of the sleep, deep sleep, light sleep. So that's what I do. I try not to give patients medications for sleep because it has side effects. It has dependency as well, right? Things like Xanax and things like that. Not sure if I'm allowed to say Xanax, but never mind. Okay, just said it. Okay, but if they want to, then I would advise them on certain supplements. Melatonin, ashwagandha maybe. That kind of thing. Magnesium plus ashwagandha maybe. So those kind of things. But the main thing is that to understand their current situation, their life, then look at their data if they have sleep data, their wearable and things like that, then after that, see if it can be modified, things like that, right? Yeah, but sleep is very important. You need about 6 to 8 hours good sleep, right? Sleep also, is linked to obesity, right? So you don't get a lot of sleep, you get stressed, you eat, right? So, yeah.
So I need to ask, a little myth and a little thing. Because as youngsters, we tend to say 6 and 8 hours of sleep, right? That's what the doctor said. So I'll sleep at 3 a.m. I'll wake up the next day, 12 p.m., or maybe even 3 p.m. the next day. Is that right?
Well, it depends on how much light goes through your curtains.
Okay.
Right. Okay. Because the thing is, light affects the whole, all the hormones in the brain. All the neurotransmitters in the brain as well. So, what you need to do is trick your brain to say that it's nighttime. Okay. So So when I was working in emergency medicine, I had this major problem, right? So working night shift, go back. It's daylight, right? And then, because of daylight, I can't sleep, right? So what I did was I installed really, the dark curtains. The dark curtains, tell the next door to keep quiet, right? My housemates. And then, because I was living in the UK, so temperature wasn't too much of a problem unless it's summer. But and that's what I do. And I put on headphones and things like that.
So that helps.
That helps to a certain extent, but it's a routine. It's, slowly and slowly and slowly and slowly.
So if you are working night shift often, that will help. But if let's say it's done on an ad hoc basis,
that is fine. I as long as it doesn't become a habit, right? If you sleep at about 3 a.m., right? There are certain things that happen, right? Your melatonin levels will not be too stable, right? So it does still affects you, right? Still affects you, right? Yeah.
I see.
Nice. But it should be okay, right? As long as you don't do it every day, right? Yeah.
Okay.
So it's fine. Once in a while, it's okay because we all understand you got deadlines, all these things, right? But the one thing is that some of the other experts, especially in the US, people like Peter Attia, Huberman, they say they reveal their routine, right? Okay, and some of them take a shower. Okay, they do some exercise to help them to get to sleep. Okay, 30 minutes of exercise.
Right.
They go and have a shower. Okay, then after that, they meditate. Right, all these things. Okay, I take a very short shower. Okay, I meditate for about 15 minutes. I meditate about 30 minutes a day, but at night it's about 15 minutes. Okay,
clear off the mind.
Yeah. So it's quite easy to do that. Just shut yourself, in a room. And put in noise cancelling and and don't do anything. So meditation is something which doesn't really quite happen or is followed in Singapore.
Right.
Okay, but it does help to reduce your stress and
I
things
see.
like that. But and then after that, they away the mobile devices and everything else. After that, the temperature goes down, and then all that.
Yeah.
Right? Yeah.
Right. So now with that, right, let's link to diabetes, right? So diabetes apparently in Singapore, or in fact in the Asia itself, it's very, very, very common, right? How do you deal with that?
So diabetes, there's two types, right? So one's the kind of the early type 1, where you probably need insulin and things like that. But that is increasing. But what's more increasing is the type 2 diabetes, and that's linked towards lifestyle, right? Linked towards lifestyle. So it's also linked towards obesity, right? It's linked towards inactivity and also diet as well. Okay, let's put it this way, right? Our portions are, well, they're not getting bigger, but we eat a lot of rice.
Yes.
We eat a lot of
carbs in that sense.
A lot of carbs, right?
Yeah.
And the unused carbs is then converted, right?
Into fats.
Yeah, into fats. But more than anything else is the fact that the carbs itself lends to elevated glucose, right? Elevated glucose. Rice, there's nothing wrong with eating rice. Okay. Yeah. I mean, I prefer rice. I mean,
it's an Asian diet.
Yeah. I mean, I lived in the UK for 12 years, but I still prefer rice, right? Yeah. So rice is nothing wrong, but there's different types of rice. You have to understand, right? Different types of rice in terms of fiber, in terms of glycemic index. Okay. Now, I sometimes use a continuous glucose monitor where I put on glucose monitor at the back of my arm. Okay, and I check. Okay, it's just an experiment, right? So I take different types of rice, and I find that things like sushi rice, it just shoots up my glucose. Right. White rice, not so much. The best one is brown rice, right? But brown rice makes me a bit bloated. So what I do at home is that I mix my brown rice together with my white rice. So I have about 1/3 brown rice. Sometimes I put half, but still makes me a bit bloated. So 1/3 brown rice and 2/3 white rice. Portions need to be controlled, okay? Because I'm 52, so my metabolism isn't that high anymore. So what I do is then I cut down the portions of carbohydrates. I increase the portions of proteins and things like that. Right. Yeah.
So does your clients actually go through this whole nutrition step by step with you as well?
Yeah. Nutrition is very, very important. So what I do is I ask them to take pictures, okay, of what they eat for
every meal
for 1 week.
So you have a gallery full of food pictures.
Yeah, they're supposed to put it into a platform called Sangsik Plus, which is an AI platform.
Okay.
But half of them don't, because they don't know how to use it.
Okay. So what, that automatically calculates how many calories.
Yeah, so I get a lot of pictures of food from them, and to me, my pain point at the moment is trying to decipher all these food.
Right.
Some of them don't take pictures, and then they say, "Oh, I eat chicken rice." I'm like, "Okay, how big?
Much, how big? You add rice, you add chicken."
So I'm like, "Oh, thank you." Yeah. So food analysis, food diary is very, very important. But I find that that coupled with other things like certain other tests. If you want to lose weight, okay, you may not need all these tests, all these things, but an analysis of your food, analysis of your activity, very, very important. Some of the clients, they're a bit more resistant towards weight decrease.
Okay.
So I look at their genetics as well. Okay. So nutrigenomics, whether they have genetic tendencies to do that, or sometimes I do a resting metabolic rate where we put a nozzle to your nose and mouth and let you rest, and then we analyze what you breathe out, and then we can see whether you're breaking down carbohydrate, protein, or fat, and things like your basal metabolism.
Oh,
so these are
through sleeping.
No, through resting, not sleeping.
Oh, resting. Okay, okay.
Resting. So there are machines that can analyze this now.
Wow.
Right. So it's a bit more advanced than your normal thing. I find that food diaries, a lot of times, patients cannot remember what they ate. So it needs to be prospective, right? It needs to be from there. But the problem is that they get very conscious So,
Yeah.
so I tell them, eat whatever, right? Yeah. So some of them even like last month was Chinese New Year.
Yes.
Some of my patients say, can I start like after Chinese New Year? I said, sure. That's why.
So when you mention about that, right?
Yeah.
Now, in your experience, does the seasons actually plays a very big impact to these such lifestyles that we have? I mean, like we talk about Chinese New Year, Christmas, but there's stuff like
Yeah. So I've got one patient in particular, right? He goes, can I redo my blood test, right? From another clinic. He did his in another clinic in December. I said, why? It's just December, and this is just what, February, right? Yeah, it's only 2 months, 3 months, right? Why do you want to do this, right? He goes, well, I went on holiday. I ate a lot. I don't think this is accurate. So if you want to do any test whatsoever, make sure it's not during your holiday. Make sure it's not during Hari Raya or Christmas or whatever.
Make sure that's a normal week, normal 2 weeks rather, right? Before you go for your test.
Yeah.
Well, but that's very interesting because I think in our Asia, especially Asia, right, all these festive seasons we tend to overeat quite a fair bit.
Yeah,
lots of gatherings.
Especially in Singapore. I mean, Singapore, we celebrate everything, right? We have friends who, So
now brings me the other questions. We have so many snacks out there, right?
Don't get me started.
Yeah. How does that contribute then?
Snacks are basically processed food. It's not very good. Okay, yeah. I have, as I said, 3 sons. Okay, so unfortunately, I get overruled. Although I tell them, look, but sons, they never listen to their parents, right? But yeah, I tell them, it's not good. It's processed, right? You have no control over your salt, sugar, additives, and everything else, right? So the processed foods, try and eat less of it. Some people say, should I eat organic food?
Yes.
Should I eat organic food? I'm like, look, food in Singapore is relatively safe as long as you wash it, as long as you cook it properly and things like that, right? Then get rid of the pesticides, get rid of the whatever, all these things, right? So that's fine, right? So not really too concerned about organic food, but what's lacking in Singapore is fiber.
Fiber. So
fiber.
What? We don't really eat vegetables.
Vegetables, right? Vegetables, fruits, right? So the more colorful it is, the better it is. Okay. Because it contains antioxidants and things like that, right? So some cherries, some all these things. Okay, we are not a nation of salad. We're Asian. We don't eat salad, right?
I mean, we're beginning, right? We are seeing more and more salads stores popping up here and there.
Yeah.
Honestly, they're not cheap.
Yeah, they're not cheap, right?
Yeah.
So I always wonder, why is it that good food is not cheap, right? So it should be cheap, but that's another conversation.
Yeah, of course.
That's another conversation. So, but the main thing is that, it needs to be balanced, right? We tend to have too much carbohydrates, right? We tend to have too much, animal protein, right? Especially fried, right?
Yeah.
Yeah. So, which is fine, when patients come to me, they say, should I, cut down on, this food and that food, whatever.
Yeah.
Okay. You'll be surprised. My philosophy is actually you should enjoy your life.
So you should eat more.
No, you should not eat more. You should enjoy life. You should enjoy food. Food is there to be enjoyed. Okay? Right? But make sure your portions.
So have to eat moderations.
Yeah.
Yeah.
So that's the thing, right? So it's about portion sizing, about looking at the level of sugar and things like that. I've got one patient. Okay, I think he's in his early 40s, right? He doesn't really need to lose weight, but he wanted to lose 10 kilos, right? Because the extra 10 kilos makes his knees hurt while he's running. He loves running.
Oh, okay.
Right? He loves running. So it makes his knees hurt. So told him, look, okay, let's, and I said, which medication, no medication, because I give that choice, right? He said, no medication. I don't want medication. Sure, let's do it, right? Analyze what he eats and drinks, okay? He loves teh tarik.
Okay.
Okay. So we just say, okay, you can have it, but yeah, maybe just a bit, or maybe once a week instead of nearly every day, right? Kind of thing. You know how much he lost in 1 month? 2 kilos.
2 kilos. Wow.
2 kilos, right? And then after that, we upped it with exercise. We upped it with all the other things. We looked at calorie portions and things like that, and he's lost it. Unfortunately, he moved to another country for 1 month, and after that,
He went back up.
just another 2 kilos. So he lost 2 kilos, lost a bit more, and then gained 2 kilos. Right? Yeah.
So nowadays, we have a lot of people. They are very conscious about their calories intake, right? They're very careful about the amount of exercise they burn, things like that. Those are very important factors. Is that right?
They are, but I would say live life. Don't get too obsessed about it. You have I mean, my watch looks like a normal watch, but it's actually a smart watch.
Oh wow.
Okay, it's a hybrid.
Mine is a normal watch.
So I track my data. Okay, as I say, I sometimes have the continuous glucose monitor and everything else. I track my data, but I'm not obsessed about it, right? Yeah. So it's good. Okay, I know some of my patients are obsessed about it. If they're watching, my apologies.
I mean, they're good,
that's fine,
right?
it's fine.
That's how they keep themselves healthy.
Yeah.
The whole longevity.
So the whole thing is that there are ways of tracking the data and things like that. You have to know the accuracy of the watches, though. Not all the watches are accurate. Okay.
Right.
Yeah.
So let's move on to the third high, right, which is cholesterol. Right. This is something that is very, very common again in Singapore itself. Right. But I'm unsure because when we talk about the first two, where we can control it with weight, we can control with diet, we can control it with exercise and all. What about cholesterol? What can we do with those?
Cholesterol is a major issue.
Pure diet or
no? Nope. There are always two or three things that you can do. One is the non-medical.
Okay.
One's a medical, right? And things like that, and supplements. Okay, and what cholesterol? Not really surgery, right? Surgery is not really applicable there. Okay, so non-medical, right? Okay, apart from the sleep, diet, what is also more important, okay, is looking at exercise. Exercise is very, very important. So exercise in terms of cholesterol and things like that, it's a combination of physical, in terms of cardiovascular exercise, okay, and also strength exercise as well. Okay, so what we advocate is usually about 3 hours to 3.5 hours a week in total. Okay, and usually what we do is we look at about 2 hours of that is 2 hours of the 3 hours is basically cardiovascular exercise. So I advocate high intensity interval training.
Okay, for how many times a week?
That's about 3 times a week.
3 times a week.
Yeah. It's not easy.
It is not easy because one of that training is about what, 1.5 hours or so?
Oh no, you don't need to do the 1.5 hours. Just do about 30 minutes.
30 minutes.
It's fine. Yeah. Don't go. Yeah.
So you would recommend a 30 minutes high intensive training intervals.
Yeah. So you do Monday, Wednesday, or Friday. Yeah, that. Okay. And then in between, strength exercise as well. Okay.
Right.
Yeah.
What if people with injuries? Right. What would you recommend them?
So I've got patients who have back pain, leg pain and things like that. I would say start slowly. Start with stretching exercises and things like that. Build up the core. Okay. If they have back pain. Okay. I used to run in emergency medicine. I used to run the back clinic in Edinburgh many years ago. And the National Health Service in the United Kingdom had a long waiting list, right?
Yes.
So a lot of the times we say, while waiting for their surgery, lose weight, strengthen the back, right, with exercises. Lo and behold, 6 months later, they don't have back pain.
Oh wow, really?
Yeah, a lot of them. So it's about strengthening the core, losing the weight. Okay, yeah, because if you think about it, the gravity, right?
Yes.
Center of gravity, pulls, right? So yeah, it's a touchy subject though. Yeah, but the thing is, if you strengthen the core, reduce the weight, you can do that. Swimming is something which is good. Okay, if they can't swim or things like that, go walking for now. Whatever it is, if you can't start with HIIT or any of the more rigorous exercises,
Right.
start with what you enjoy. And I always say, in terms of exercise, do what you enjoy, because there's no point going swimming if you don't enjoy swimming, right? There's no point going for yoga. I mean, I don't go for yoga,
Okay.
right? Okay, because I don't enjoy it, right? But if a patient says they want to go yoga,
Right.
sure, right? They want to go line dance, sure, right? What you enjoy, okay? Have a tracker,
Have a tracker.
then track what is your heart rate, your breathing rate during the exercise. Some of the trackers will also show what zone you're in, zone 2, zone 3, whatever.
So when you say have a tracker to track my heart rate, my breathing rates, what is optimal in your opinion?
So in terms of basal heart rate, it depends on your age, right? So 60 to 80, they say is a good heart rate, right? I would say going to about 1.5 to 2. Okay. For that period is good. Okay. But what's most important is what's comfortable for you.
Right.
It cannot be that your basal heart rate is 80 and then your exercise is also 80.
Yes.
Right. So at least you increase it. For me, it's a gradual transition. So and work towards strengthening it. You cannot be from one day you cannot run to the next day, 24 hours, you run a marathon. It cannot be so it's step by step, right? Yeah, step by step.
I see. So, Dr. Hisham, before we end off, right, today's show, right, maybe you can tell our viewers, right, some tips, right, for longevity before we end today's show.
Right. So, the tips are basically quite simple, okay? Eat well, exercise, or eat properly, I should say. Exercise, sleep well, okay? Lessen your stress, okay? Enjoy time with family and friends, because that's actually a key part of longevity, all right? Unfortunately, you have to be financially savvy. Okay, that's important, okay? Because if you're going to live till 85, you need that, right?
Yes.
Okay. And don't smoke, don't drink too much. Watch the supplements you take, okay? Some of my patients take 30. Yeah, I have one.
30 supplements.
I have.
Wow.
So if you need to know what's up, ask me. Okay. So, but at the end of the day, enjoy. Just enjoy your life, and we are here to guide you, right, and not force you to do things and things like that, and try and keep you healthy for far longer, right?
Yeah. Thank you very much, Dr. Hisham.
No problem.
There you go, ladies and gentlemen. Right, I hope you've enjoyed today's episode. I've tried, guys, to get more snacks for you guys, but that's for sure. Now you know that you need to have more rest, right? You need a work-life balance, right? I hope you enjoyed today's episode, and I'll see you soon. Hi, guys. Thank you for listening. If you like what you have just heard, follow us for more content like this.